Good evening, everyone, and welcome to tonight's program. This is the second part of a two-part program dealing with chronic pain. And if you had not heard last week's program and would like to, please write back to Catherine, who sent you your login information for tonight, and let her know that you would like to have the recording from last week, and she'll be happy to send it to you. That way you'll have both sides, the medical and the new emerging therapies that go along with the medical, either before, during, after, um, and so on. So for all of you who do know us, we are the Friends of South Shore Health. And for those of you who don't, we are part of the community outreach effort that our health system, South Shore Health, makes all the time to reach our community members with information, with help, with dealing with whatever needs dealing. We have an amazing health system, and the Friends stand in support of that in a number of ways. We do raise money, um, and we do it through having fun. I mean, we believe that the more fun people have, the more money we raise. And so we have 3 signature events, and I encourage you to go online at southshorehealth.org/friends and look them up specifically. But we have cornhole tournament, which is loads of fun for those of you who have or maybe have never played cornhole before. It's wonderful. And that happens in the fall. We have we have a set the pace road race, which you can walk. You can go at whatever pace you want. It's some people go to really race hard, and a lot of us go for a beautiful walk in the woods at Wampatuck. And we have Kicking Up Country. And whether you like to line dance or hoedown kind of music or hoedown kind of food, it's a lot of fun. So take a look at all of those. They're not super expensive, and know that what they do is help patients and families in cardiovascular care, in pediatrics, and in all around the hospital, where for things that there is no budget for. So that's where we step in. All right, the next slide tells us a little bit about what's upcoming. We are going to one program a month beginning in April, and that program is Nutrition in the News. And with the changes in recommendations and information about ultra-processed food, these are both hot topics, and we have a wonderful dietitian to help us understand and help us figure out what we need to be doing, what's good, what's not so good. In May, lung health, diagnosis and treatment. We're looking at diseases like COPD and chronic and acute lung issues. In June, we have a dermatologist, fat spots and skin protection. We've been looking for a dermatologist for a couple of years now. So now we have one, and we're very, very excited to bring that to you. And in July, we have a wonderful speaker. He's an entomologist, and he's going to be teaching you about bug bites. The insects that are here, the ones that are newly arriving in our area, and he has the most gorgeous photographs to see. So even if it's just for the photography, but also for the information, it's really worth doing. And so hopefully we'll see you at all of these programs. For all of you who have not muted your microphones, please do. And now let's go to the introduction for Dr. Chung. I couldn't fit all of what Dr. Chung does and is skilled in this slide. So take it as someone who has heard, seen, and talked with him extensively. Look at this: massage therapy, polarity therapy, Reiki master, licensed massage therapist, student of life, which is really true. He's the founder and chief clinician of New England Wellness Solutions of Hanover and Norwell, specializing in pain management. So he's the right guy for tonight, for sure. So he's looking at new methods and he is eager to share those with you. And I'm not going to steal his thunder about what they are. So, Dr. Jimmy, it's your turn. And thank you for being here with us.
All right, thank you, everyone. Thank you, Julie, for that awesome introduction. And I'm going to go ahead and share my screen. I have a really nice presentation, but also, I think what we're going to do is we'll have more of a conversation today. And so, looking forward to the conversation with you. I have a list of questions from Linda, Lynn, Stephanie, and also Paula and Pamela. So I'm going to go through, and then Diane last on that list there, last but not least. But I will go through all of your questions. In fact, some of them will be answered in the presentation as well. And so we're going to breeze right through that. And we do have the chat function. So feel free to use the chat function if you need and ask questions there. I know some of you may be dealing with, I think it might be some speaker issues. So if you go right into the chat function, we would be able to see your particular questions. And we will have plenty of time at the end of the information part so that you can ask your questions as well. I have these beautiful blue light blockers here. They help you with eye strain. So if you're dealing with any eye pain, these are phenomenal when you're at the computer a lot. So I have a couple of pairs of these, so you'll see that. And right now we're loading up what you could see on my screen. This is just a little bit more about the little pieces of paper on the wall in terms of what we have to do to be able to help patients. I actually got my training at South Shore Health with Dr. O'Donnell and Dr. Limke, the medical director over at the pain clinic, the Social Orthopedics in Hingham. And it was such an honor to be able to learn with them and to study with them and to see patients with them. But a little bit more in terms of what it takes to become an acupuncturist. So you can get your master's and then be licensed by the Board of Registration of Medicine here in Massachusetts. A lot of the clinicians here, there's only 500 in the state of Massachusetts compared to 50,000 in California, just so you can kind of compare notes. We're also certified nationally, which means we can move from state to state and still meet the regulations and meet the standards of care from state to state. And, part of the reason why I'm here today is because of the Friends. And I know Julie had shared a little bit more about what the Friends does, but we're really here to build community. We're really here to build friends through education, through events. And my biggest struggle growing up was chronic pain. When I was a kid, I broke my my right humerus, which wasn't humerus, and I also tore my right hamstring. For some reason, I didn't think it was a good idea to warm up before going in for a kickboxing match, and tore my hamstring. I've broken bones in my hands and my feet from doing kickboxing and also running track for Brockton High. And I was also a boxer at Brockton High. They call them Brockton boxers. So my whole life was always about being able to get rid of pain. That's what I'm very passionate about. I have to say that today I am pain-free. I don't know what it's going to look like tomorrow in terms of gym time, but being pain-free for today is a blessing. And we're going to talk more about that as well as we breeze right through this. So today is breaking free from chronic pain. This is what we have for you today. It's about 45 minutes, give or take, maybe less, and then we'll break into questions. I have some of your questions already, and as we go through the chat, we're going to answer some more for you. But what we're going to cover today is the reason why there's so many folks on this call. We have about 50 people on the call. About 10 of us are suffering from chronic low back pain. So, we talked about Linda and Lynn and the other Linda in terms of their back pain. There's 7 more within this group that's dealing with lower back pain, and that's probably the 4th one is me. And so today I am pain-free. and I'm going to share with you some of the things that I'm doing to be pain-free, um, because I know it intimately. And then the other thing is, why is it that for some of us drugs may work, and why is it for some of us surgery may work, and then for some of us it doesn't? So what are those particular scenarios? We're going to talk about the true cause of chronic pain, how it affects our health, our relationships, our work. I'm going to break into the statistics on that and the research behind that. And then my big idea is you heard about last week. Last week was a really nice, informative uh, 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 presentation on chronic pain and the history of chronic pain. But you got a chance to listen to one of the anesthesiologists at Social Hospital, where you got a chance to see the history of how pain was seen and how we manage it, but also what are we doing today. I like for us to focus on this big idea that your body is your pharmacy, and that we can tap into your body for its healing response, which I think Julie and we probably taught that class back in 2016, the ability for your body to heal on its own. And then we're going to break into, originally I wanted to share with you the science and the therapies that we're offering now, shockwave therapy as well as ozone therapy and the science behind that, which I think is phenomenal. But because of the presentation from last week, I wanted to incorporate a little bit of acupuncture for pain management, because I know that would answer some of the questions that some of you may have, but also it addresses the beautiful layup that we got from last week as well. We're going to talk about physical examinations and what we do with kinesiology and body mechanics using Egoscue and the Alexander techniques to actually help you with your chronic pain issues by education and through education, meaning how do we increase your ability to minimize your pain on your own. And I have so many different giveaways that I like to share. And so you see my phone number right up here above my head. If you want any of the free guides and the tutorials that we put together, I have a couple of 2-pagers for chronic low back pain. I have a 2-pager guide for neck pain. I have one for nerve pain that's a 1-pager. And then I have one that would be an overall like a 16-page, any possible pain that you can think of. We would give you a nice homework item that you can utilize for reducing your pain levels at home. And then we're going to break into what we do from a treatment standpoint, from the different phases of corrective care, optimization, and then maintenance care. And then I like to share at the end a very special um, we get a lot of great results, but for me as a clinician and a 4th-generation practitioner in my family, I'm very biased. And Paula will share with you about my love of the medicine. I'm very biased, so I like to share with you what other patients are saying about the care. And we have a very special guest that recorded a video, who's a surgeon at the hospital at Social Health, and I'd like to share that with you today as well. So here we go. You guys ready? Let's have some fun. So the chronic pain epidemic was what we had mentioned earlier. The reason why there's so many people here today is because so many people suffer from chronic pain. We can break down the issues, but really we're talking about, are you off balance? Are you afraid to fall? Do you feel unsteady walking? Do you feel unsafe at home? All these different things here. Are you frustrated that nothing has worked? You've tried shots, you've tried medication, you've done PT, you've even had surgery, and nothing has helped you relieve the pain. Have you been told that nothing more could be done? And this is why Julie has graciously put this all together, is when you feel like there's no hope, it might be something else. It's in fact the reason why I keep searching for more options and more solutions. And so I keep searching, I keep looking through the research, I put it into practice, and then we get to help the community with it. So some of the statistics that really hit home with me, you'll see that 51 million Americans deal with chronic pain, and 8 out of 10 of those Americans have low back pain. So this is the reason why when we think about out of the 50 of us, there's at least 10 of us that's dealing with uh, back pain at some point. Um, and then you break that down even more. There's about, I mean, 40 of us who's had acute back pain at some point. So the numbers are staggering. And if you look at this, right, 40% of the folks who have chronic back pain develop into depression. And that's there's a correlation there, and I'm going to talk to you more about the mechanics of that and what happens when pain is unresolved. And when you look at the economic factor, $635 billion spent on lost work and healthcare related to chronic pain. It's a staggering number. And the number one cause of disability here in America is chronic pain. I mean, it's amazing um, what we're looking at here. And 70% of the folks who are dealing with chronic pain, medication doesn't help. We see that quite a bit in the clinic in terms of patients coming to us because they've tried all of the above and it hasn't worked. So, they land on our clinic and they say, "You're our last hope." And as much as that is an honor, I really hope that we can see that there are things that you can do at home, and we're going to convey that with you today on the different things that you can do at home to help yourself with chronic pain. So why current treatments may not work for some patients? Why is that? So you'll see here opioids and narcotics like OxyContin, oxycodone, they don't really address the root cause of the condition. They only mask the pain. All right. And then you see there's a number of patients who actually get addicted to the opioids, and then it becomes an issue. So you see 80,000 overdose deaths in the US annually. And that number is better now because the pandemic is over. But during the pandemic, we were at about 135,000 people because folks weren't around to help in cases of overdose. So folks actually passed away from it. So it went from about 80,000 before the pandemic to about 135,000 during the years where we were social distancing. NSAIDs cause gut bleeding and all sorts of kidney and liver function and heart failure. And so being able to find a way to get off of the meds will actually support your health long term. We see that steroid injections not only break down cartilage over time, but it also increases your glucose level and decreases your bone health. And so we have to look at injections with the idea that we're going to use it short term as a bridge to go from where we are to a comfortable place, but not as a crutch long term. Post-surgical scar tissues is a real thing. We have to help our patients break up the scar tissue because, as in fact, the scar tissue is causing the binding around soft tissue like muscles and tendons, and also nerves, and then causing pain. So, we see all these different issues here in terms of what would happen with drugs, injections, and surgery. Now, one thing that I do find to be a big concern for me is that some of the patients who have chronic pain, there's issues with balance where you're not steady on your feet because of the pain. I think one of the gals had mentioned that there's pain in the lower back that runs down to the foot. And so when you have that type of pain, your knee and your ankle can buckle. And when you're taking pain meds, you can get a little groggy. And so you combine off balance, and then now you're combining grogginess, and you're in a recipe for fall risk. And so Julie and I, we've put together a lot of classes where we help with balance and we help minimize your fall risk. Um, but that's something that we find patients will come to us and they will say, listen, drugs and surgery and shots didn't work for me. Now I want to try something else. So chronic pain does something to us and it causes other issues. So what we find is that when you're in pain, this is the reason why it causes depression, which you saw early in the statistics, which is recorded by the National Institute of Health and the CDC. But when your cortisol goes up because of the pain, it suppresses your immune function and it also disrupts your sleep. So, you're getting pain and now you're not sleeping. And because you're not sleeping, you have more pain. You're getting pain, so your stress level goes up. And because your stress level goes up, you get more muscle tension. And the muscle tension causes more pain. Can you see the vicious cycle there? It's a terrible vicious cycle where you can't end the pain cycle. And then if you're taking the pain medication, what happens is as a side effect, you're dealing with IBS, or you're dealing with acid reflux, you're dealing with food sensitivities, and so you're dealing with the other symptoms. Now, your mental health begins to decline. Now you're dealing with depression, anxiety, the pain, and some people will maybe disengage with communities and friends. They can't even sit to have lunch or dinner with their friends and family. And so you lose out on friendship time and family time, and it leads to hopelessness. So you can see that the reason why it leads to depression is because it takes away from your life. How much of a disruption? It takes away from work, from sleep, from relationships, and then also the money that's involved to actually fix it. So the finances. So that's what we mean by the cost uh, of actual dealing with chronic pain. And you can see here, look at this, $3,000 a year just on prescriptions and lost income, right? I mean, these are significant changes in somebody's life dealing with chronic pain, irritability, withdrawal from relationships, right? You also have so many appointments to go to, when you're in pain. I'll share with you, when I am in pain, I have a lot more appointments, whether it's acupuncture or massage or physical therapy or chiropractic, or even seeing my PCP or, whatever it is that he would recommend. Um, and it takes away from my ability to work. It takes away from my ability to exercise. It takes away from my ability to play on the floor with my four kids and let them wrestle me. But more importantly, it takes away from my mental health, my ability to be relaxed and be productive and enjoy my day. And that's a thing that I find to be the biggest cost for me is that mental health piece. So one thing that I've learned through the research, through the evidence, is that your body could be your own pharmacy. And this is such a big idea because I've seen the research on what happens. And last week you saw the functional MRI studies. Um, what we're doing now for research in acupuncture is measuring what's happening in your bloodstream before and after treatment. So we can measure the changes and the biochemistry changes that's happening in the bloodstream. And so your body is in fact healing because of the direction and the signals that were given to your body. And we can set those signals through your environment. We can activate those healing components through acupuncture points. We can do that through shockwave and ATP. I'm going to explain more on what those things are. But what we're saying is your body can heal on its own. And I'm going to share with you what happens, right? So you may get a paper cut or scrape your knee on the coffee table. What happens right away? Your body gets a micro trauma and it detects this issue on the body. Your body sets an alarm off. The immune system comes right in. It starts working. And then you have something called inflammation. Lynn, I can see your question. That's a great question. We're going to answer that for you. And then the other thing is, Karen, a lab work can test how high your cortisol level is. And so it's a specialized test, and you can see as you're going through treatments the cortisol level going down. But as cortisol goes up, inflammation also goes up. We want the cortisol from our adrenals to be in check, and you want that low because our life is already so stressful. There's, we have such a big information overload with negativity that we're constantly releasing cortisol. So when you have a chronic pain condition and your body's releasing more cortisol, you're in big, deep trouble. Um, so what happens here, I'm going to go right back. I'm going to answer those questions at the end in terms of the Lynn's question there. But the healing phase begins, and then new cells come in, blood flow comes in, nutrients come in. And what happens is now the, with acupuncture, the same mechanism happens, and you create a micro injury, and all of a sudden the cascade of nitric oxide comes into the area, triggering all the healing, the nutrients that comes into the area, and in fact, we can actually create some stem cells to be produced from using proper techniques of electroacupuncture. We're gonna go through the science of that as well. But what happens as a result is you get a controlled healing response. You're saying, I'm going to create a micro injury. And to Lynn's point, does acupuncture hurt? The short answer is no, not really. You may feel a little pinch as the size of your hair. And what I'm going to do is I'm going to try something very bold here. I got a little blister pack here, and there are a bunch of pins here, and I'm gonna see if you can even see it. I got one in my hand right here. I'm waving. Can you see that? I'm gonna put it right next to the. See how big my finger is compared to yeah, right there. Wow, I'm surprised my camera can get it. So it is tiny as the size of your hair, and so typically, and we're going to go through this as well. Some of the other questions that folks will ask is, does it hurt? And are there any contraindications with blood thinners? There isn't, because the pins are so small that your skin closes up right away. So that's what you would get from a micro trauma standpoint. I know that there are some more questions in the chat. We will circle back to it and answer all of them at the end, but I just want you to know that we're going to file that to the end so we don't miss anything important here that would answer questions for everybody. So here's what happens with the chemicals, the pharmacy that I was alluding to earlier. You have this manufacturing ability in your body to produce all sorts of wonderful biochemistry that is pain relieving, anti-inflammatory, and then also regenerative. And so you see that when you're giving your body the right direction, you get a release of endorphins. These are the chemicals you get when you're exercising, you're feeling good. You get nitric oxide, which I mentioned earlier, where you can get more circulation. So nitric oxide won a Nobel Prize, and it was dubbed the molecule of life because it brings in circulation. You also get the stimulation of stem cells for cell regeneration. It repairs the soft tissue, and it's phenomenal when we're talking about shockwave. I'm going to break into that a little bit more about my journey of why and how I found shockwave through a patient of mine. And then you also get a release of serotonin, which actually helps with pain, but really we use it for a mood stabilizer so we can get you sleeping again. We can minimize the depression so that you can begin to turn off the cortisol production so that you can actually feel better and stop that pain cycle. ATP is another thing that we're stimulating. If you remember back to sixth grade science, ATP is something our mitochondria creates, and it's adenosine triphosphate, and you need that for cellular regeneration. And of course, we're also affecting the cytokines and the tumor necrosis factor, which are inflammatory factors in the body, and we can turn the switch off on those, the production of those factors, their cytokines and tumor necrosis factor. And we do it in two ways. It's called neuromodulation. We do it in a way where we can release something very similar to oxycodone, Oxycontin, the narcotic drug family that we talked about earlier, but it comes from your body. So we're producing endogenous opioids versus exogenous. Exogenous would be something you're taking from the outside, and then endogenous is something your body produces on its own. So here's some really cool evidence on the four therapies that I had mentioned earlier. So we have here ancient wisdom, and you know, the physician from last week had mentioned that acupuncture about 4,500 years ago was documented to help people with pain. So ancient wisdom, we talked about the flow of energy and blood flow and the flow of body fluids. That was covered last week as well, by Socrates, right? Socrates says the four main vital fluids. And then the idea of preventing injuries from happening. What do you do to create harmony in the body to prevent injuries? And so what we did was we said, well, why don't we bring that up to date? Because when my great uncle was practicing, he's now retired. He's 89 years old, and he was practicing up until this year. He's losing his ability to see, and so practicing could be challenging. And so he did not have access to electroacupuncture. He did not have access to ozone and shockwave and ATP therapy. And so what we've done was we basically took, and this is the beautiful thing about these classes, is that you get the best of both worlds of integrating Western medicine with Eastern medicine, and you bring it together so that patients get the best care. So we're basically merging modern technology so that it actually is able to provide better results and get folks over the hump, and then also to be able to maintain the results that they got initially from the treatments. So here's the breakdown of the research, and we've gone through some of this already, but this is really neat. Electroacupuncture has been studied now for decades. We see that it has about like an 80 to 90% effective rate at our clinic. So 8 to 9 out of 10 folks who come in with pain will get results. And it's phenomenal. It actually matches exactly to what the randomized clinical trials are in the market in terms of the statistics. And you can see that it improves circulation, it does nerve regeneration, releases those feel-good hormones that we mentioned earlier with the endorphins. And then the other thing is that somebody had asked, what does it treat? Well, for chronic pain, we see a lot of back pain, sciatica. We also see neuropathy. We see arthritis and fibromyalgia, migraines and joint pain. And there's a lot that we do. We have patients who come in with psoriatic arthritis, rheumatoid arthritis, that their joints are so swollen they can't really grasp or make a fist. And through these treatments, they're able to be able to make a fist and use their hands. Not to mention being able to be comfortable standing on your feet. So this is what I mentioned earlier, the research behind ATP therapy, so adenosine triphosphate. What it does is it helps your body create more of what it's able to do for cellular repair. And for a while, our treatments were plateauing with neuropathy and nerve pain. So when we're thinking about numbness, or one of the participants had mentioned pain radiating down the leg, that's a nerve pain. And in order for you to heal that nerve pain, you actually have to heal the nerve. And by helping it to regenerate, because what happens is the nerve gets impinged, and when it gets impinged, it gets damaged. And so what happens is you have to heal the nerve for the pain to go away. And we see that with just acupuncture alone, we were plateauing. But when we combine acupuncture with adenosine triphosphate, we were able to get folks who were plateauing with their nerve pain to then go beyond that and find a place where they're comfortable. What's really nice about this is there's no side effects. I will say this, there's a caveat with some of the treatments. So So for example, with electroacupuncture, we typically don't do that for our pregnant patients. And for ATP, we typically don't do that for our pregnant patients and our oncology patients, which we help a lot of oncology patients. And the reason why is because there's no randomized clinical trial studying ATP on pregnant patients and oncology patients. But if we did, it would be great because then we can start using it for them as well. So we go by clinical research and we go by the evidence. But here's why you hopped onto the call today was for the ozone therapy. A lot of people don't know what this is. It's really just electrocuted oxygen. So you turn O2 to O3 by having it run through a generator. You have a standing outside in the summer and you get a lightning strike and you can smell the electricity. That's ozone. And so we're using a medical grade ozone to help patients. And what it does is it activates your antioxidants and it takes away inflammation. That's how it's helping with the pain. But more so, we're finding that patients who have constant infections, they're using ozone therapy at our clinic because they just feel so much better. And what I mean by that is we have patients who are sick probably 3 to 4 weeks before they get better. With the help of ozone therapy, they'll be sick for maybe 3 to 4 days and they'll be better. And we have doctors and nurses who come in for the ozone therapy because it helps them with inflammation and pain, healing for after surgery, and also to minimize their risk of getting sick when they're exposed to viruses and bacteria. So this is what ozone therapy is. I'm going to show you exactly what we do from the nasal insufflation, the wound care, and also the e-insufflation that we do for e-infections. So you'll see here, this is a really nice research from the Free Radical Biology and Medicine, and also the World Health Organization on doing a systematic review of ozone therapy. And what they found in the research is that when you're getting ozone therapy, your blood cells are better at delivering oxygen and nutrients to the tissues. And when we find that you're able to do that, you heal faster. Isn't that cool? And I think a lot of us, we deal with circulatory issues, my feet will get cold because of circulatory issues, So we want more circulation in our body because it's the molecule of life. All right, so step one is you upgrade the oxygen and you turn it to O3. And so now you have electrocuted oxygen. You get about 5% of that from our treatments, and then the other 95% is oxygen. So you get more oxygen into your body, and that's typically pretty helpful for your body. And then the step two is actually making sure that we minimize inflammation. So again, turning on those antioxidants. And step three is killing viruses, bacteria, and mold. So we have a lot of patients who get exposed to mold, whether it's like a dampy basement level living, or they might have gone into the attic to do some spring cleaning and they've breathed in a lot of mold. They'll come in for ozone after that. And step four is you get the repair crew. Ozone comes in, it helps with the cartilage, it helps with the tendons, brings inflammation down, brings more blood flow in, and that's the repair crew that happens with ozone therapy. Here's a picture of what the ozone therapy is. So you'll see a generator, you'll see kind of like the different flasks that we run it through, and we would run it through different flasks for reasons of making sure that the ozone is not drying for you, so it moisturizes it. And then we have these huge tanks of oxygen, and we run the oxygen through, and we would provide you with the ozone therapy. So this is what we have for generators for ozone therapy. If any of you are interested in terms of like seeing it in real life, we have clinic tours here at the clinic, so you're welcome to schedule that to see it in person. And then shockwave therapy. So Years ago, I had a patient who was coming in. He's a tennis player. He plays over at the Weymouth Club. As some of you who are local, I know we have calls from all over the U.S., but the local folks, the Weymouth Club is a big tennis club, and he was dealing with calcification or bone spurs um, in the Achilles tendon, and he had Achilles tendonitis, but also with the bone spurs. And he would come in and he would get electroacupuncture here, and the moment he goes back onto the tennis court, the pain comes back. And I said, oh man, I can't believe this. There's nothing I could do. So this particular patient goes to the pain clinic in Hingham, and he comes back and he says, hey, my Achilles tendonitis is gone. And I was like, how is that possible? And he says, well, shockwave therapy. And at the time, I knew nothing about it. And so this was 7 years ago. So I started digging into the research and learning more about shockwave therapy and the evidence behind it, because I never want to share a particular treatment that's not evidence-based with my patients, because you know their time and it's just we would never do that. So Shockwave came to me through my patient, and the guy's pain free. He's back playing tennis. So now we're doing the same for our patients here. And so Shockwave is a combination of sound therapy with a strong electrical pulse. And through that, you get to stimulate stem cells in your body to regenerate cells and then also create healing. And what's really nice about this was shockwave therapy was invented to break down the kidney stones. But while they were going through the back and whatnot, patients who had back pain, the pain would go away. Patients who had calcifications, their calcifications in their spine would break up. And so now we're finding new ways of using shockwave therapy, and it promotes a lot of blood vessel formation for things like tennis elbow or golfer's elbow. And what happens is with these are very avascular when you're thinking about tendons. And when you can bring circulation in, your body heals on its own, if that makes sense. There's very little vasculature in the tendons, meaning avascular. And we get some great results here, 77 to 80% success rate for plantar fasciitis and tendinopathies and shoulder conditions. But I will say chronic plantar fasciitis, like the condition that Gronk had, this is amazing for it. And I've seen this to be better than acupuncture. So pretty cool stuff that we have this now for shockwave therapy. And so you'll see this here. The British Journal of Sports Medicine did a meta-analysis, and the Journal of Orthopedic here in the US also did some research on shockwave therapy. I shared with you when they did this, 2012, because I want you to know this isn't new. This is just new to us because I wanted more time to pass so that other people can be guinea pigs, so that my patients wouldn't have to be the guinea pigs. And so what it does is it wakes up the local tissue through a vibration, through the sound, and it tricks the body that there's a new injury, just like what we talked about earlier with the micro injury. Then stem cells begin to rush in, and so tissue begins to repair. This is what they see in the Journal of Orthopedic Research. And then step three, collagen begins to build. Now, you know, collagen is the backbone and the foundation of all of our tissues. So when collagen begins to build, now you can actually rebuild tissue. I mean, it's the coolest thing. And then new blood vessels begin to build around the injury site. And you have more of the workers that are coming in, the circulation, the nutrients, because we need the proper vessels to carry in the healing components in our body. Otherwise, it won't heal. So this is the device. You'll see the gun there, the blue gun, and then you see the different heads. So the larger heads we use for like the back, shoulders, and then the smaller heads we actually use around the joints of the hands. So we have a lot of hairdressers who use their hands, and we'll just go right into the joints so that they can continue using their hands. You know, you use your hands for everything. But I know we've done a class prior to this. I think it might have been 3 months ago on arthritis of the hands and how to manage that. So if you like a recording, you can request that from the hospital because we take a deep dive into it in terms of what you could do at home. So let's continue on because I love to make time for all of your questions. This is kind of a breakdown of what is the best therapy. These and again, these are all non-invasive, and they're ways to tap into your own body's healing capabilities. So you'll see here, electroacupuncture, great for nerve pain. ATP is phenomenal for fibromyalgia. So we actually we make it a point now to not use electroacupuncture for our fibromyalgia patients because there's a risk of making the fibromyalgia worse. But the ATP will always make the fibromyalgia better. Ozone therapy is great for arthritis and also for immune function to make sure that you don't get those constant infections. And then shockwave therapy is phenomenal for those connective tissue, tennis elbow, golfer's elbow. I can't show you my foot because I'm not that flexible, but great for plantar fasciitis. So you'll see here the things that we do to find the root cause. This is very important. We do physical examination, neurological examination, sensory exams to see what's going on with nerves. We also do something very special that's not on here, and I forget how valuable this is. We do an analysis on all the different supplements and herbs and vitamins and drugs that you're taking, and we make sure that there's no interactions. So we had two patients last week come in with major interactions with what they're taking for diuretics, and they're also taking a vitamin D, which then actually increases their chances of getting calcification in joints. And these two patients are getting calcifications in the spine and then also in their knees. And they're coming in for low back pain and they're coming in for knee pain. Well, they both went back since last week to this week. These are new patients. Talked to the physicians about it, and the physicians are now aware that these are complications that will happen with these interactions, and they're taking them off of those drugs so that there's no more calcifications happening. Now, if you have calcification in the joints, you'll get pain. But imagine this, calcification in the cardiovascular system or the brain. We don't want that. We know that it could happen, but it is terrible for your quality of life when we're dealing with that. So that's the other thing that we do to get to the root cause of the issues. And I'll tell you, these two patients have been with us for 1 week. This is the second week, and their knee pain's already getting better. And it's phenomenal to actually see those results, but you got to see what's actually contributing to the pain. 3 phases of care. We talked about this here in terms of your roadmap to lasting recovery. And somebody had asked, does the treatments actually last? And it does, but you have to maintain it. So you'll see here, if it's an acute issue, no problems at all. It's going to last. If it's a chronic issue, we go through a corrective phase. This takes 1 to 8 weeks, depending on the condition. And then also how long you've had it, and also your demo. So age group matters. So we see that our younger group, they heal very fast, and it takes them less time. They bounce right back. And then we go through an optimization phase, and the optimization phase allows you to go beyond the initial relief. So we go to lasting relief. And that means that you can go without treatments and still feel pretty good. And once we get to that phase, if you are in an acute pain, you won't need maintenance. If you're in chronic pain where it's degenerative, then maintenance is going to be recommended. Okay? So we want you to make sure you don't need us. And what we do is we teach you how to take care of your own body through body mechanics, what you can do at home. So there's a lot of conversations happening. I think Paula had mentioned earlier, we have a lot of conversations in terms of what you could do for your knee pain, for your back pain. And we're going to keep on answering questions. And I think we're going to dive into that in just a little bit. So here's what we notice. Session 4 to 8 is when you notice the most significant relief if it's a chronic condition. We also notice that when patients come in to see us, they can minimize their drugs and they can minimize their need for surgery. We've had countless of patients scheduled their surgery and then basically canceled it because they're not no longer in severe excruciating pain. And so we're getting 80 to 90% effectiveness for our chronic pain patients. But I wanted to share this with you, and I hope you can hear this. But here's a short video of a
Hi, my name is Lillian Larson, and I am a patient of New England Wellness for the last few years. Let's see, so what has brought me in here today? Well, I tore my meniscus and I was in a great deal of pain. So, why am I here? Because Jimmy has treated me before, and my knee right now is feeling, I can't even tell you. It's a gift. I can now walk without pain. I still have a little bit more to go, but the pain relief on it was amazing. What else can I say? But there is no better gift than the gift of health. And to be able to walk and play and dance once again is amazing.
You could tell that Lillian's a dancer, so she loves dancing, and you can't dance with bad knees. And so it's so nice to see her back dancing. So here's what some folks are saying. Sandra says after 3 years of chronic back pain, 2 cortisone shots that didn't really help her. She was very skeptical about getting better. And look, check this out. On her fifth session, she's able to sleep through the night for the first time ever in terms of the chronic low back pain. You see that Michael also said he was able to avoid rotator cuff, avoided surgery on the rotator cuff, and shockwave therapy, amazing for it. 85% better, just kind of like the statistics that we had shared with you earlier. Robert says numbness in both feet. We actually had somebody put more mileage on their feet. They had neuropathy and they couldn't walk, and they put more mileage on their feet running. It was an ultra marathon. It was like 50 miles for the race, and they trained for it. So they were putting more miles on their feet than I did driving to and from the clinic. We have Patricia saying that fibromyalgia had me housebound for 2 years, and ATP was able to get her back to gardening and playing with the grandkids. But here's a special guest that I wanted to share with you, and then we're gonna kind of wrap it up real quickly and get um, to
My name is Dr. Gary Gibbons.
questions.
It was a pretty devastating injury 6 months ago. It was a massive rotator cuff tear. I still had pain, a loss of mobility. He provided hope, a team approach, part of therapy that we haven't really paid much attention to in this country, yet it's so important. He really opened my eyes, and the results speak for themselves. I'm now 6 months post-op where I am today. From acupuncture really helped relieve my pain and really improved the mobility. I got a really good report the other day on mobility and pain control. This has been a great part of reaching. Acupuncture changed my life because it brought another dimension of care, team approach, patient-centered, but looking at me as a person. It really added so much value. My pain was a 9, and now it's at best a 1 or a 2. My favorite part about the visits is the team approach, patient-centered. Everyone has a smile. Everyone is sincere, but really dedicated to what's important for me and what my goals are. It's actually fun coming here.
That's awesome. Thank you, Dr. Gibbons, for sharing that. He's actually going to be doing some research with me, so we're going to be publishing some paperwork on longevity. We're going to be measuring the you know what? We're going to keep that as a surprise, but it'll be fun. We're going to do some longevity work, and we're going to be publishing together. So there's hope. Sorrow looks back, worry looks around, and faith looks up. So we've helped a lot of patients here at the clinic. We've had a total of 7,000 patients here at the clinic over the past 16 years. This will be our 17th year, and we've been able to restore life for a lot of people, restore joy for a lot of people, get them the independence back to play tennis and run and do all these little things that I would say just brings them joy, playing with the grandkids. So here's one thing that I'm going to share with you. If you have pain, I want you to stop pain by stopping and slowing down and listening to your body. I want you to practice taking a breath. And when you can take a breath, 4 count on the way in, hold for 4, and then out for 4. it relaxes your nervous system so you're not releasing the cortisol, which is going to tighten your muscle and cause some more pain. And then I want you to observe, what are you feeling? Why is this causing pain? What position or movement am I in? You have to understand and be aware of your body movements so that you can minimize the flare-ups. And then you ask yourself, how do I proceed? How do I move forward with this movement? How do I control the speed of my movement so I don't flare up my chronic pain condition? And if you know, because this could really help you instead of poking at the bear and constantly flaring it up and really increasing the inflammation, you're stopping the pain by slowing down, taking a breath, observe what you're doing, and then seeing how do I best proceed. And a lot of Americans, myself included, we like to power through, power through, power through. Well, when we power through, we make the injury worse. So I'm going to give you that little advice there is the best way to stop the pain is by stopping. The silver lining, and I'm going to be a little mean on this one. The silver lining is this, my friends. There's about 50 of you on the call, and I'm going to sound very harsh, and I'm going to sound like I don't care. It is such a blessing that we get to experience pain. Why? Because the folks who are 6 feet under, they won't be able to experience pain. So pain is a guide, is a signal, and it's also a reminder that we're alive. As much as it's terrible to feel the pain, it's that silver lining. I want you to really shift that perspective and understand that pain means you're alive. And seeing it as a blessing that we're still alive. And what that does is it again brings down that stress level about the pain, because the pain can get us really irritable. And when we do, we begin to create that vicious cycle, and then it causes more pain. And I want you to just focus on the silver lining that we're blessed to have pain, that we're still alive, and that'll break the cycle for you. So here's what we're doing. If you're interested in a free consultation, feel free to save that number there, call the clinic. You also have my cell phone number up here. I'm giving you a 16-page free guide to how to manage your pain at home. You can just shoot me a text or give me a buzz, and I will get that guide to you. That is like overall supplements to take, foods to eat, things to avoid, exercises to do. There's a routine that we would actually include. That's a 30-minute routine or a 40-minute routine to end your day. And there's a short routine to begin your day to minimize your pain as well. So that is free to you. And then there's also separate, like if you want something just for lower back pain, we have a separate 2-pager for that with 12 different things that you could do. So just save the number, shoot me a text or call, okay? And then also if you visit our website, you'll see there's a bunch of education on there. It's free education to you. My favorite piece of education is 13 hours of how to minimize your stress and create more joy. It's kind of a platform that we started off with the hospital years ago, and now it's actually available to you for free on the website. And what that does is, again, it minimizes your cortisol level, it minimizes your stress, it lifts your mood through the endorphins and the serotonin, and then you can break the pain cycle. So I want to thank you for your time today, and I want to open up the floor for questions. And I know I have a bunch of questions as well. But a quick reminder, because I'm selfish, I serve on the board for friends. We have a nutrition seminar coming up April 16th. And then we have a run walk get together at Wampatuck on May 2nd. And then one of my favorite events, Picking Up Country, music, dance, food, drinks, friends, and that's going to be June 6th. I hope you join us. I really do. I fell in love with this organization by doing one of those events, and that was 2012. And gosh, I'm still here hanging out with Julie and the crew. So thank you for having me today, and I want to open up the floors to questions. So go ahead and unmute your mics. I have the first question came from Linda. Linda asked, I have back pain and sciatica. I had an ablation, but the pain keeps coming back. The reason why the pain keeps coming back is after you burn the nerves, it's kind of like gone for a little bit, but our nerves have the ability to regenerate. So when it regenerates, the pain comes back. And I mean, you do want the pain signals. The great thing about the ablation is that you don't get the pain signals, but it's like your fire alarm's going off and you remove the batteries. So you're doing things that would actually exacerbate the condition and make it worse. Versus if you had the pain signals, but you manage it well, you'll get better relief with that. Linda Hutchinson had also mentioned that she's dealing with back pains and like multiple strains. You know, one thing I would encourage you to use a stop pain method and really hit pause, take a breath, observe what you're doing, and then proceed. I think that's really going to be a great tool for you. And as I'm talking here, anybody who has more questions, feel free to jump in. I haven't seen the text messages yet because I wanted to focus on the presentation for today. We do assess and individualize the treatment for you so that we would know what's best. Lynn had mentioned back pain as well. It was why she was on this call. I do have that 2-page guide. There's 12 different things that you can do at home for your low back pain that you might not be doing already. And that involves nutrition and gentle exercises that are safe. So you can incorporate that to help you with the back pain. Stephanie had mentioned something about muscle spasms. I would recommend 2 things. Magnesium glycinate, which is something you can get at Walgreens or CVS or any pharmacy or at the health food store. You can put it in with water, do 300 to 400 milligrams, and that'll help you with the muscle spasms. I would start with the 300 before the 400 because it can give you like an upset stomach and cause some diarrhea. So I would start low and then build up. But it has been phenomenal for me. And also, if you have nerve pain, the magnesium glycinate helps with nerve pain. The other cool thing is if you're dealing with muscle spasms, apple cider vinegar. Take a teaspoon or a tablespoon, and the muscle spasms in 7 seconds will go away. It's phenomenal. I mean, they have a product called Hot Shots, and they use it for athletes. They're a little bit more expensive. These are just kind of like the home hacks here in terms of what you can do that's cheap and easy. Paula Chambers had asked about knee pain. I know you had some questions, so feel free to unmute yourself and hop right on if that's what you like to do. But if you like to ask the question on chat, that's up to you as well, and we can go through that. Let's see here. I'm going to stop sharing so we can see more faces on the screen, and that way maybe more folks would ask questions. And oh, look, I can see the chat now. Thank you for all of that. Pamela had asked about chronic pain. She was just curious about the different things that we do for chronic pain. So you got 4 different modalities there, but I'm open to sharing more. And then Diane had mentioned about a pinch nerve. I took some notes here. I wanted to answer everybody's questions. So the pinch nerve that goes all the way down the leg to the foot, that's an L4, L5 impingement. You have to be very careful with twisting motions. So any twisting motion is a no-no, like raking. So you can't do yard work. You can tell somebody else to do the yard work for you. Twisting motion, like if you were gonna carry like a laundry bag and then turn, or like the trash, that's very tough on the L4, L5 because that's the twisting. And our back isn't really meant to twist, it's meant for flexion and extension, so straight movements. That's why they say when you're shoveling snow, and we got a ton of that, is that you don't twist your back because you'll really jam the disc. And you have a disc issue that's impinged on the nerve. And that could be, x-rays won't confirm it, but the MRI imaging study would. And at our clinic, we actually review that with you and make sense of the imaging studies with you so that you know exactly what's happening in your body. I think those are all the questions that I had listed and I took notes on in the beginning, but I'm open to any more questions that you might have.
Jimmy, there's some questions about insurance, whether insurance covers any of these treatments. And if so, is it Medicare only? Is it Advantage plans?
That's a great question. So Medicare does not currently cover for low back pain. Um, what it does cover for is low back pain if acupuncture is performed by a medical doctor, a physician's assistant, or a nurse practitioner, not by someone like me. And so you would have to find, a clinician that would actually be licensed in both. That's rare. I think there's two east of the Mississippi. I know one of them, but they don't accept Medicare. So, I think it's challenging to find the clinicians that do. Medicare Advantage does have coverage. So you do have coverage with Medicare Advantage. That's a Part D in Medicare versus the traditional Medicare. And so there is coverage. I will say this, I don't know if you remember earlier, I said there's 500 clinicians here. That's licensed by the Registration of Medicine here in Massachusetts. There's 50,000 in California. There's a lot more insurance coverage over there. So clinicians go to school here and then they migrate to another state with more coverage. We have about 25% coverage overall here in terms of multiple policies. There's about 10,000 different policies. And then for each particular policy, they may only cover for certain diagnostic codes and certain CPT codes. So it varies depending on the condition as well.
Okay. Another question. People are wondering about the length of effectiveness of treatment. How long does it last? So whether
Yes,
it's
yep,
ATP or ozone therapy or acupuncture, and everybody's different and the problems are
yep,
different. But can
yep.
you give us some idea? Is this
Absolutely. Absolutely. Our kind of gold standard is to get patients who have severe chronic pain to first go through the corrective phase, and then once we optimize, the relief should last. And the relief should last until you re-injure it. And so it really depends. That's why the education piece is so important. We want to give you the tools that will help you stay healthy on your own so that you don't need us. But what we want to do is we want to put you on a maintenance schedule. And the maintenance schedule for some of our doctors and nurses, they come in every 11 weeks or maybe every 9 weeks for like a tune-up. It's like a oil change for your joints.
a question? Would acupuncture conceivably increase a mast cell response to mitochondria or microtrauma?
That's a really good question. I would have to look into the research for that, Jenny. That's a really good question. Because I do know that microtraumas do increase that mast cell response. But I don't know the mechanics around specifically for acupuncture. So what I'm going to do is if there's a way for us to actually um, come back with an answer on that, that's something that I don't have research on. So let me see what I could find on my research library.
I would love that, and I really appreciate it. This is Jenny. That was my question. So I have Ehlers-Danlos syndrome, POTS, and mast cell activation syndrome, the trifecta, and have significant debilitating chronic neuromuscular and musculoskeletal pain due to that. That has been increased since I've had cancer twice in the last 2 years, and chemo has increased my underlying conditions and also neuropathy as well. So I would be concerned, like I would be interested in getting acupuncture or massage, or I'm actually also a Reiki practitioner, so very interested in that modality. But I would be concerned about the microtrauma with the cytokine production increasing a mast cell response and worsening the conditions.
Right, right. Yeah, and part of this too, Jenny, the honest truth is we can look at the research, but the research gives you a bell curve of the population. You almost have to be your own lab mouse and try. Or not try, but what I'm saying is, it doesn't matter if it's Reiki or you're trying a particular food. You have to see how your body responds, because it's tough to make a generic. I'm gonna see if I can find a generic bell curve on research. But I think with the research, there's a caveat that it might not apply to you.
I really
I hope that
appreciate
helps
that.
there,
And that's
Jenny.
honestly usually the response is that I'm not an average patient, so you're not going to necessarily. But yeah, I would think with the
Yeah.
increase in cytokine production, which you did mention, that tends to both liberate histamine and increase mast cells, which is a normal response to healing.
Yep. And then when you have the other layers of complexity in terms of your health history, it does it gets a little gnarly where you almost want to have an approach of being very conservative. And whatever you try, like let's say the normal dose is 400 milligrams, you try 100 first, and then build your way up because your body's hypersensitive.
Can you go back for a moment to the blood tests, and can a blood test tell you how much cortisol is in your body?
It can, yeah. So you can take a specialized cortisol. In fact, my PCP does that test for me. Dr. Tremblay in Braintree. So he gives me a test to measure my cortisol level because that's something that we've been tracing to see where I'm at with cortisol. So you can get the panels for that.
Mhm.
You mentioned apple cider vinegar, and you mentioned something else too.
Yeah,
Um,
magnesium glycinate.
what is it called? Magnesium glycinate.
Magnesium glycinate. Yeah.
Okay,
Yeah,
thank
I
you.
can type it into the I can type it into the chat if that helps.
Mm.
You can get that at CVS or Walgreens. It comes in like a pill form or a powder form. I like the
Mm-hmm.
powder form because I use it for my workout. So I bring it in, like I have some right here in my water thingy, my Owala. And so I have it right in here. So I'm getting my magnesium. And it's great because I don't get those muscle spasms. But if I actually go to the gym and I'm pushing myself, and I don't have my magnesium glycinate, I will get the muscle spasms.
Thank you.
You're welcome.
So
Great
the
questions. Keep them coming.
immune system reset. Can you talk about
Mhm.
that a little bit?
In terms of using acupuncture or in terms of using ozone therapy?
She didn't say in the question. It was a question about immune system reset. A
Okay.
friend of hers has a problem with her eye that nothing has helped so far,
Okay.
and she
I
wanted to see
wonder
if
if that,
there's.
yeah, I wonder what the condition is because there's so many different conditions with the eye. I wonder if it's macular degeneration,
Um,
or if it's, oh, go right ahead.
sorry, that was my question. It was maybe for ozone therapy. A
Uh-huh.
friend of mine has a chronic eye. She thought it was like a sty in her eye, but
Oh,
she's had
yeah.
so many treatments and antibiotics and
Hmm.
injection in there, and nothing's helping it. So it might be like a chronic infection. I'm not sure, but I
Correct.
don't know if
Yeah.
ozone therapy would help with that.
Oh, you know what? Ozone would possibly help because it does change what's flowing around in your bloodstream. And
Yeah.
so one of the things that I wanted, Dr. Gibbons actually was going to do a whole education piece on that. We didn't get a chance to because of timing, but he was actually gonna update everybody on the ozone therapy, the surgeon that was on earlier. Um, but yeah, so the ozone would help with that in terms of minimizing the like mold or bacteria that's flown around in the bloodstream. And
Yeah.
so it would be helpful in that standpoint. But here's one thing, Paula. When we're dealing with any chronic infections, the one thing that you can do to help yourself is to minimize your carbohydrate intake, minimize your glucose level. Because what does bacteria like? Glucose.
Hmm.
Yeah. So if
Yeah.
if we can
Yeah.
if we can starve the bacteria, then you'll actually get to control, the infection.
Yeah. Okay.
Yeah.
Thank
And
you.
Paula, you also had a question about the knees. You
Yeah,
can
I've
feel
actually
free to
been
ask about the
having
knees as well.
treatments with you guys,
Yep.
and I had more inflammation in my knee.
Yep.
Started to really bother me. I couldn't even really walk down the stairs.
Mm-hmm. Mm-hmm.
So I just didn't know like how many treatments would I need to help with that inflammation, because I had a
Got it.
couple so far.
Yep.
I think I had two, and
Yep.
it feels better. I don't know if that's just all in my head, or if
Mm-hmm.
after 2 treatments that can be helpful?
Yeah, so one of the things that we did today was we educated folks on what happens after one treatment. And so some patients will get the results right away. Um, so after 2 treatments, they do multiply and compound. That's the cumulative effect of the acupuncture. And so earlier, what I mentioned in the presentations were releasing like the drugs in your body, your own pharmacy,
Right.
producing endogenous opioids. And so with the electrostim, we're creating these short-term acting opioids in your body that would bring the pain down. And typically with regular acupuncture without electro, it takes twice as long to get the results. That's the reason why that, when I look at the way that my great uncle practiced and he never had electroacupuncture, which has only been around for 50 years.
Mm-hmm.
It's the reason why we have acupuncture in the US is because of electroacupuncture, because they use it for open heart surgery and brain surgery in Asia as an anesthesia. Or a local anesthesia, so that you don't have to pay extra for anesthesia that would put you out, which the anesthesiologist had shared about last week. So
Yeah.
electroacupuncture is able to minimize the pain very quickly.
Yeah, because I did notice a change, and I can walk down the stairs and it's not excruciating. So,
That's
Great.
beautiful.
yeah,
That's wonderful to hear, Paula. Thank you so
yeah,
much for sharing that.
you're
So
welcome.
a question from Allison, what's the difference between ozone therapy and hyperbaric?
Yeah, so hyperbaric is not electrocuted oxygen. Hyperbaric is basically in a chamber with oxygen. And so where the confusion lies is some folks are doing hyperbaric for with ozone. So they're basically in a chamber with ozone in there to help with wound healing
Right.
and also for hair loss. So a lot of the men are using hyperbaric ozone for to regenerate the cells for hair growth. And then there's also diabetic patients where the wounds won't heal and you need hyperbaric ozone for that. But hyperbaric can be separate. It's just to increase your oxygen. Ozone is electrocuted oxygen, and then there's a marriage of the two where they combine ozone with hyperbaric. I hope that answered your question.
It did. Thank you. I actually worked at the wound center with Dr. Gibbons. So I
Oh
was
my gosh.
semi-familiar with the hyperbaric. I did not do hyperbaric, but
Got it.
yes, thank you. It did. Thank you.
Yeah, perfect. Perfect. Thank you, Allison. That's so helpful.
So Jimmy, with things like fibromyalgia and other chronic conditions, arthritis, some of these that aren't acute, but they're nagging soreness and nagging pain. When these treatments are used, whichever they are, is there a lasting effect or because that's such a persistent thing? Does the
Yeah.
ATP or whatever the methods are, does it produce lasting results at any duration?
So it depends on the condition. So for some conditions, once you're done with the treatment, you're done until you re-injure yourself, like you take another fall or something like that. But for the degenerative diseases, that's where you would actually need to come in for maintenance. Yeah, and degenerative meaning like joints, discs, degenerating. That you really need to come in for continued maintenance. Um, and so, for example, we talked about like chemo-induced neuropathy earlier with one of the callers here, and so that's a degeneration of the nerves because of the chemo toxicity, and so you really need maintenance for that so that you can kind of keep on making steps forward. So for certain patients, it would last, and then for patients who need additional care, you need to come in for maintenance.
For things that are mostly muscle and tendon
Those are
bound.
easy. Those are quick fixes. We're talking about severe chronic pain, where you
Well,
would need.
fibromyalgia is can be pretty severe chronic pain. but it's
And then
not.
we have patients here with fibromyalgia that can go for months without a
Ah,
flare up. Mhm.
okay. Oh, that's wonderful to know.
We also have patients who have severe, like autoimmune,
Mhm,
psoriatic arthritis. We have
mhm.
rheumatoid arthritis where they're on all sorts of autoimmune drugs, but it's not helping them. And what we do is we do a vagus nerve stimulation with electroacupuncture. You can actually go to the Netherlands and get a surgery for that with Dr. Kevin Tracy, who is an American surgeon here, and he started a clinic in the Netherlands to do an implant at your vagus nerve, and you can charge the implantable device, which Dr. Wenger actually talked about last week, implantable devices.
Mhm.
Um, and you can implant right on the vagus nerve and would actually minimize your pain cycle.
Wow.
And what it does is it tells your body to stop producing cytokines and to tell your body stop producing tumor necrosis factor, which causes inflammation to go up and cause more pain. So we do that treatment without the surgery, if that makes sense.
Mhm.
So we're stimulating the vagus nerve without having to do the surgery in the neck. And it's an implantable device. And what you do is you put on a necklace and it charges it through a magnetic resonance. That's
Cool.
Dr. Kevin Tracy. He is the kind of the leading physician that heads up all the research on bioelectrical medicine.
Ah,
Dr. Kevin Tracy.
good to know.
Yep.
So there have been a number of articles recently about as we age, our stem cells um, don't repair or don't replace to the same degree they used to when we were younger. Does ozone therapy help that?
So ozone therapy, adenosine triphosphate, ATP therapy, electroacupuncture, they all help that. Yeah. And the only thing I didn't bring up shockwave. Shockwave does that as well. The only thing that I don't like about shockwave is it's actually painful. So
Mm,
not ideal for our fragile patients, but
mhm.
with the strong, robust, the gym rats per se, they love shockwave therapy.
Are there
What?
questions that we haven't answered yet or addressed yet? If so, please wave at us and
We have a
open your
hand up
speaker.
from Linda Hutchinson. Her hand's been up for a while. And then we still have a hand up with Jenny. So not sure if that's another question. Oh, Jenny lowered her hand. We have a hand up from Eleanor
Yep,
or Kim. Mhm.
Kim. Kim, do you have a question?
Linda
Kim?
has one as well.
Okay, fire away, Linda.
Looks like Linda's muted.
Okay. Kim, you're muted. Do you have a question you want to answer? An answer for?
Well, I'll tell
Okay.
you, Julie, this has been great. I mean, the class participation and engagement, this is so much fun. This is why we keep coming back and teaching these classes.
It is
I have a
fun.
question.
Oh,
I
yes,
just
go
have
right
a
ahead,
question.
Patricia.
If you make an appointment, do you assess which is the best treatment for you of all the 4 different treatments that you use?
Yeah, you go through a full assessment and basically we handpick and individualize. So for some of our patients, herbal medicine is in the mix. For some of our patients, we teach you how to do certain exercises. You'll see that in the free guide that I put together for you. So you'll learn exercises. For some of our patients, we have to customize a nutritional plan. And then for other patients, we have to give you mindfulness practice, meditation practice. So there's a combination of different things that we do. A lot of those free resources are already on our website.
Thank you.
So for all of you, take a look up above Dr. Jimmy's head and write down the phone number if you want any of these things sent to you, or if you look on their wellness website and don't see it or don't know how to find it, then let them know. A question from Lynn. What It went away. Where did it go? Can
She
you
had a
hear me?
she had a statement, and she says, I do meditations, thus I go to salt caves for healing. Salt caves are incredible. There's one in Situate. There's actually a couple in Situate. But you can also get a salt lamp you can put at home to clean and cleanse the air. So something you can do. Yeah, Hamilton, there you go. Yeah, that's a nice one. Yeah,
Where do you
there's a
find the
bunch in
wraps,
Vermont.
Jimmy? Where do you find
The
the
what?
wraps? The
Oh, not
wraps, the
wraps,
salt.
lamps.
Oh,
The lamps.
lamps.
Yeah, yeah,
Ah,
yeah. There you go. Lynn says she's got salt lamps as well. Hey, what other questions might you have? I know Kim still got her hand up, so
I think she
but
was waving hi when she
yeah.
first got here.
Got it. Yeah. So questions can always go to my phone number. But here's the caveat. I will say that when you call or text, I'm going to invite you to the next Friends event because the Friends is really here to build a community, and we have an amazing community here. And I love you to join us on the next in-person event because they're so much fun. They are
It
so much
is.
fun.
I will echo that. Jimmy and
Yeah.
I are both are long-term Friends members. So, and we do have a lot of fun with everything we do. So, just let us know.
I think with that, we'll wrap it up. And you guys have my phone number. Feel free to reach out. And I look forward to catching up with you. Thank you so much for this time.